Let's get down to business.
And thanks for being with us on the podcast today. I'm Kenny Rahmeyer. We are pleased to have back with us today, he's been with us before, Dr. Mark Malone, the founder and president of Advanced Pain Care. Thanks a lot for being back with us on the podcast today.
Thanks for having me, Kenny. I'm glad to be back.
Let's, for those that missed our first segment, our first podcast, give our listeners just a little sense of what your practice, Advanced Pain Care, is all about.
Advanced Pain Care is a multi-specialty practice of about 30 doctors and associated personnel. We all focus on the care and treatment of chronic pain patients. We have about 7 specialties that are all focused on this, and it includes pain management, orthopedics, neurosurgery, rheumatology, addictionology, and physical therapy.
Very good. Well, the last time we talked, when we finished up, we were talking about how you and your practice had managed your way through the pandemic. And I guess one thing that I remember reading a lot about, Doctor, over the course of the pandemic was, I don't want to say the advent, but I'll say the acceleration, the adoption curve of telemedicine. And I'm just curious, is that something that you all did much of pre-pandemic? Is that something you're doing a lot now or plan to do more going forward?
Yeah, that's a great question, Kenny. We did not do much telemedicine before the pandemic, and it was limited to people who couldn't really get out of bed or get to one of our clinics. During the pandemic, and when it was at its peak, we did a lot of telemedicine. We discouraged travel, and we discouraged in-person visits just like most clinics did, and we were able to switch to telemedicine. We did find out that we're not considered a luxury, so we had no decrease in patient volume. We had just as many patient visits on telemedicine as we had before in person, so it was successful. Normally, the Texas Medical Board does not encourage prescribing pain medicine or any controlled substances by telemedicine. But they lifted these rules during the pandemic so that we could practice the full scope of our specialties by telemedicine during the pandemic. And my understanding is those rules and regulations have been reinstituted for the most part, but still there's a lot of exceptions. So we still do some telemedicine, but it has shifted back to mostly in-person visits now.
Well, one of the things that is clearly around us all the time these days, sadly, is inflation. And
yeah.
I've certainly understood that in a medical practice as extensive as yours, I can only imagine just the input cost and all the various things that you have to deal with that obviously you're paying for, you're paying your suppliers and so forth, and then having to decide how much, if any, are you passing that along to the consumer, so your patient. So tell us a little bit about your challenges along those lines, if you would.
Well, it's a huge challenge, Kenny. It really is, because the medical business is unlike any other business in that our fees are fixed. Pretty much the way things have evolved over the last 5 decades in this country is Medicare sets a price for every service that a doctor can perform. And these prices are copied by all of the private insurers. Mm-hmm. And some of the private insurers will give you a little bit of a bump, like a 10% bump over Medicare rates. But for the most part, they're roughly equal to Medicare rates. And these are decided on by law. Medicare is a government institution, and they meet, their committees meet and set prices for everything. And you can't negotiate. Individual practitioners can't negotiate. The government and Medicare have a tremendous incentive to take care of the people that depend on them. But when inflation happens, they're slow to respond. Of course, they can't respond rapidly like a free marketplace can. Mm-hmm. And so after 7 or 8% inflation the past 1 or 2 years, their fees are way behind. So the doctors are struggling. All the doctors are struggling, and all the medical businesses and even the hospitals are struggling today.
Well, I can certainly understand that. And in fact, I read an article in the Wall Street Journal recently that not only talked about the tremendous cost pressures that you all have, but this article really focused on the shortages. And I want to touch on these in a few categories, Doctor, starting with the medical device industry and just surgical equipment and so forth. Is that something that you all have experienced, and how are you dealing with that?
Absolutely. It's a huge concern now, whereas in the past it wasn't much of a concern because the free market system in the United States is very efficient. But because of the pandemic, a lot of these efficiencies have gone away, and various pieces of equipment, even like the special medical grade screws and braces that we use in surgery, we can be very short on those. We might have a waiting list. We might have to push surgery back. Also, some of the medications, the drugs, we are short of some of those. And we have to rotate and find alternatives, and sometimes push surgery back. It's a real concern now. We have to it's like another dimension has been added to the practice of medicine.
Yeah, I'm sure. And so to deal with that, you talked about pushing surgeries back. That's one option, I suppose, if you just simply don't have the pharmaceuticals or the right kind of surgical equipment. Have you gone through the process of expanding your supplier base? Does that not do any good because nobody else has it either? Or
there in each category of equipment or pharmaceutical, there are at least 2 or 3 suppliers. So we're in touch with these international suppliers. So we just have to focus on what's available and plan our surgical week and surgical month based on what is available and is on the shelf. It's like I said, it's another dimension we never had before. It's hard on the consumers. It's hard on the patients. It's hard on the doctors and nurses too, but it's something that we have to take into account.
Yeah, and have you found, are you managing more inventory as one of the ways? Maybe you keep more stock on the shelf a little bit than you would otherwise.
Yes, we do. We keep more stock on the shelf, like if some anesthesia drugs, some anesthetic pharmaceuticals are available this month, we'll stock up on those. We have to store those. We have to be cognizant of what the shelf life is, of course. So that's just an example. And same thing with the other surgical supplies and other medical supplies. And we also have 3 pharmacies, and we have to constantly search for all of the pharmaceuticals and medications that our patients need to stock these pharmacies.
So that's just a trade-off, though. I mean, you want to try to have the product when your patients need it. Obviously, You have more inventory, and that's more cost of operations for you month to month, isn't it?
It is. It is. When you have to buy in advance and keep it on the shelf, not only is that money tied up in inventory, but you have to take care of it too. You have to store it in a climate-controlled, sterile environment, and that's expensive as well. Plus insurance and security and all of that. It's a whole nother branch of business.
I can understand. And as we begin to wrap up with Dr. Malone, last time we talked, you'd mentioned that Austin's a good place to find very good talent. Even with that, and you have such a huge practice, I think you'd mentioned, roughly 600 some people total with all the doctors, the nurses, and so forth. But what about the shortages of nurses, technicians, and even some of your frontline workers that have seemingly been so hard to find, the good ones these days anyway?
Absolutely. Yeah, there is a critical shortage of qualified people in every field, including doctors and nurses and managers. And so you have to be really good to the people that you have. You have to maintain a superior work environment and superior morale and attitude, and you have to provide upward mobility, raises and whatever you can do to attract and keep your employees. And so we're real lucky. I think it goes back to picking the best people all the time. It provides for a great work environment and great morale. And I think most of our employees would rather work here than almost anywhere.
in your environment, the work from home model is not so easy. So what I'm getting at here is that you're trying to keep the best people. You want to make sure they have a good benefits package of competitive salaries and so forth. I suppose you try to offer flexibility wherever you can because that's what everybody else is doing. But you have limitations along those lines.
Very true. Some people can work at home. Some of the back office, the billing people, the coding people, insurance verification people, some of them can work from home and do. And so that's fine. That's all good. But most of us are patient-centric and patient-facing. So we have to be in our clinics every day.
Boy, that's got to be a challenge, and yet so rewarding, I'm sure, and certainly a benefit to your patients who need the care and are glad that you were there. We really appreciate all the time that you spent with us here, Doctor. Before we let you go, give our listeners your website in case they'd like to find out more about your practice.
Well, I always say search for Advanced Pain Care or Dr. Mark Malone, and our website will come right up.
Dr. Mark Malone, founder and president of Advanced Pain Care here in Austin. Thank you so much for being with us again on the podcast today.
Thank you, Kenny. My pleasure.